Welcome! In this video, we'll be talking about important things to think about as you try to manage this new chapter, like the health professionals you meet, the treatment options you might hear about, how to deal with your pain, how to know what to eat or drink, a better understanding of the insurance issues that you have to deal with, and more. But before we start, we know that you might have loved ones that are helping you through this tough time. And if you want to wait to watch this video with them, now is a good time to pause. We know that most patients who have the support of their families and friends do better. To the partners, parents, sibling, family member, or friend watching this video, we want you to know that we, your healthcare team, know that it's difficult to watch your loved one going through so many changes, and it is normal that you may want to do all you can to help. But it's so important to listen to them and really hear what they need from you and for you to respect their decisions. There can be a lot of information to process, and by being present, you can help them better understand what is happening and support them on their journey. If they are overwhelmed and need you to take on more, do what you can, but don't forget to take care of yourself as well. Okay, so now we're ready. Take a deep breath, everyone, and let's get started. As you go through this process of having tests, treatments, other checkups done, you meet many new people in your care team like doctors, nurses, dietitians, and other helpful people. They tend to come, meet with you for a little while, and for many, you might not know what they are there to help you with. So, we thought we will explain what they do a bit more. Please know that all of them talk with each other, and the plan is for them to work together to help you with all of this. An oncologist is a cancer doctor who will handle your overall care. The surgeon or surgical oncologist is a doctor who might operate on the tumor if this is what you want. A gastroenterologist or your GI doctor is a doctor who does important work with a special camera to better help you deal with pain and when you have trouble eating. If you end up needing to stay in the hospital, you may see a hospital doctor called hospitalist. Since your own doctor may not always be at the hospital at the same time as you, the hospitalist will help care for you. Other doctors will be asked at times to check on you. They will often say hi or tell you what they are there to help you with. The nurse is someone you will most often see who helps you with whatever is needed with your treatment, such as getting you the medication you need as told to them by your doctor, and then telling you when and how to take it. Dietitians will help you figure out what is best for you to eat and drink. A social worker checks in with you about other things that are important part of your care, like your insurance, how you get to the hospital, making sure that you are getting enough food, are able to pay your bills, and have people to help you at home. Depending on the stage of the cancerous tumor, your team will have a different plan. In the early stage, surgery may be an option to remove the tumor, but sometimes chemotherapy treatment is given first to shrink the tumor and make surgery easier. Chemotherapy treatment, or chemo, is given to help kill cancer cells. It can be given to you as a pill or as an injection or an infusion. Infusion means that the chemo is given to you as liquid through your vein using a tiny tube or a catheter. This allows the chemo liquid to slowly enter your body. Most of the times, this happens at what is called an infusion center. Another treatment is radiation therapy. The idea is to burn cancer cells using targeted X-rays. This is also usually done at the hospital by experts. In addition to these treatments, you may have the option to join a clinical trial. Sadly, pain is a part of this disease and it can be a lot to deal with. But it is important for you to talk to your doctor about your pain because you don't have to suffer. There are many ways to treat your pain, like through pills, patches, acupuncture, and other methods. So let us know what you are feeling. Cancer can change your appetite and how your body uses food, and this might mean that you lose a lot of weight. So you may need to have a smaller and more frequent meals, and you may need to be picky about the foods you can have. Your doctor and dietitian will help you figure it out if you need to take something else to help your body to use the food better. You may also need to drink liquids more frequently because both your illness and the treatment can cause your body to use water up faster. If you notice you are having a hard time eating food or get full quickly, it is important to tell your doctor about it, as it may be a sign for something blocking how you deal with food that can be treated by the GI doctor or surgeon to help you eat better. In these videos, we've been reminding you to tell your doctor what you're feeling. Cancer is tough on your body and takes a lot from it. So it's important to talk to your doctor and let your loved ones or caregivers know about the different things you go through, such as not having appetite, feeling tired, not being able to go to the bathroom, having trouble sleeping, pain, feeling like throwing up, or having your body feel like it's burning in places. At the end of the day, remember, your doctors don't know what you're feeling, and if they don't know, they can help you manage it. With all that's going on, it's easy to forget what you wanted to tell your healthcare team when you see them. So write it down somewhere. It also helps to have a calendar where you can keep track on how you are feeling. One more thing, many of us have grown up with homegrown or traditional ways to help us when we are sick, which is great, but it's important to tell your doctor about these remedies. Most of the time, the things we do are harmless and can help, but sometimes they might get in the way of the treatment your doctor has for you. Remember, like everything in life, it takes a team. You have your healthcare team and your family and friends. It's important to share how you are feeling, both physically and mentally, so that they can help you in the best way possible. Often, they will need to be the ones advocating for you so that you get the best medical care possible. And now, back to the loved one that is watching this video with you. It may be hard to watch your loved one deal with pain, weight loss, and discouragement, and difficult to understand what they are going through. So try to be patient. Ask them about how they are doing, and most of all, listen to what your loved one is saying. Respect their choices and be kind. One way that you can help is to accompany them at their appointments. Don't be afraid to ask questions and speak up for your loved ones even if it does not feel right at the time. In addition, you can always reach out to your community health worker if there are some concerns. We know that providing support and showing up for your loved one can take a toll on you as well. So take care of yourselves. Only if you also take care of yourself can you support them. Also, please know that there is help for you as well. For instance, you can enroll in the In-Home Supportive Services, IHSS program. This program allows you to be an official caregiver and receive benefits for the important work you do. If you are interested, ask your social or community health worker about signing up. These are truly tough times for everyone, but there are a few simple things that can be done to support you. Things like self-care are important and can happen in many ways. The bottom line is do whatever helps you feel better. You could do this by making your surroundings more comfortable and pleasant. In the next video, we're gonna talk about why this is so important. But for now, be kind to yourself and those around you because this is hard for everyone.